Male infertility problems are quite common. We will find it in about 40% of the males, and this doesn't even take into account the fact that in maybe 20% of other couples there will be a male factor as well as a female factor problem contributing to their lack of success. A lot of the common causes for male fertility, some of them are very serious, some of them are more minor issues, but clearly we do see anatomical problems where a man may have a varicocele, a dilated vein in the scrotum that can have an impact on heat regulation of the testicles, and therefore that may contribute to certain problems. Of course, anatomically there may be blockages in the vas deferens, the tubes or pipes that deliver sperm to the outside of the body. Some men are born without a vas deferens. There can be other anatomical injuries to the testicle. There can be infections that we will sometimes see in the prostate gland that will affect the sperm. Many times we will find hormone imbalances relating to diabetes, thyroid disease, stress can affect the pituitary gland, and that can have an impact on sperm function as well. Obesity has a negative effect on the amount of heat generated to the testicles, and that's not good for sperm. Smoking, very toxic. Excessive exercise can turn off sperm production. We use a good percentage of supplements that contain antioxidants that are very protective to the sperm. Conception XR, male fertility supplement by Coast. These are two just examples of brand names, but they contain zinc, vitamin C, vitamin E, carnitine, an amino acid. I often will add CoQ10. These have been shown to make a difference. It doesn't work overnight. It takes often 2-3 months to protect the sperm, improve the sperm, but these therapies are very useful. So that's a good place to start with changing the lifestyle, but also using very simple vitamin antioxidant therapy to start improving the process. In those cases that have failed just with medication, for example, putting a man on Clomid, if his testosterone is low, will help to improve his sperm. But in conjunction with that, we'll often resort to intrauterine inseminations, or IUIs, where we simply wash the sperm, put the best possible sperm into the uterus in large amounts. And by doing that, by putting millions in the uterus, we're going to get thousands into the fallopian tubes at exactly the right time. And that often will work. If that even fails, then IVF, in vitro fertilization, clearly allows us to put the best sperm into the eggs by doing ICSI, intracytoplasmic sperm injection, and that oftentimes will give us a success. On rare occasions, for the more severe forms of male factor, surgery is an option. And for those that have azospermia, which by definition means a lack of sperm, or very low sperm counts, under 1 million, for example, then we can do testicular biopsy. Very gratifying to be able to surgically extract sperm, place them into eggs while doing IVF, and achieve successes. At the end of the day, when we're dealing with male infertility, it is extremely gratifying for these guys to become dads when they've been told that they've got a poor sperm count, or there's other problems, or that they've been doing something that's very toxic to their sperm. So when we're able to achieve a success and they become a dad, you talk about life-changing, it's a new person.